யாழ்ப்பாணத்தில் ஹேக்கு முடிக்கிறான். தமிழக ரூசன் அங்கே நினைக்கிறான்.
Kopili. Secretary. Oh, Arul. Secretary to lega to mind. Yeah.
Good morning, ladies and gentlemen. Rajan Ramanathan, Dharmalingam Siddharthan, Charles Nirmalanathan, and Mr. Thavaraja representing Honorable Douglas Devananda, Mrs. Kumar Chandra Prakash representing Opposition Leader, and Health Secretary Dr. Palita Mahipala, Northern Province Chief Secretary Mr. L. Ilangovan, Health Secretary Northern Province Mr. Arul Raj, Provincial Director of Health Service Dr. Saman Padirana, and Dr. A. K. Swaran to represent all RDHS in Northern Province. And I kindly call one doctor from base hospitals and divisional hospitals to lighting the traditional oil lamp. Yeah. Chief Secretary Northern Province Mr. Ilangovan to deliver welcome speech.
Anevarikkum vanakkam, ayubovan, assalamu alaikum, very good morning to all. Today is yet another important day in our province where the Honorable Minister, Health Minister, Dr. Ramesh improvement in the province. So, first of all, I warmly welcome the Honorable Minister, Dr. Ramesh Patrana, to the Northern Province for this important. of the province. Next, I directly committed to the health development, and he knows the in and out of this health business in the northern province. And also, it's pleasure to welcome the Honorable Angadian Ramanathan and Honorable Sridharan for their continued. And I also extend my warmest welcome to the Secretary of the Ministry of Health, Mr. Mahipala, who has always have a soft strengthened health institution in the province. And also welcome hospital, all the senior members for this. With a note, you are well aware the the northern province have recurrent expenditure for the health sector. And secondly, when compared to the capital allocations, we are on average, out of which we are allocating nearly 11 billion to the health sector, which is, we have reactivated and rebuilt all the hospitals, which are almost 15 years over, and need some improvement and the maintenance period sector. And other important issues that we have to bring to the Honorable Minister, and I know there is Honorable in place, there is 3,000 card is vacant at the moment. And additionally, we have extended the service with other projects, and Coimbatore Mandi Hospital, then Kilnochi Women Excellence Center, then Mangulam Rehabilitation Center, which is a unique hospital. But those hospitals are, as HE's mentioned, it's along the A9 road. It is not the provincial hospital. That's also been improved our health conditions or the living condition of our citizens. That is the other requirement. That health, the preventive and the curative circumstances is required to cater that particular section of the population. So with that note, definitely this day will be a very important and a happiest day for us in the history of the health development in the northern province.
It's done by Dr. Mallavaran. So patients are coming not only from Jaffna or northern province, patients are coming from southern province, Gaul, and we are now trying from there to get the operations done here. And patients are coming from everywhere in the country for the cardiac catheterization to Jaffna Hospital. Excellent service are rendering, but there are issues within that. When it comes to, if you look at the number of doctors, there are vacancies here and there. That is, if you look at as a percentage, out of 1,300 doctors, 205, 15.8% of medical officers
established A&E unit under drive project under the soft law from the government of Netherlands. I have listed created facilities. Secretary also mentioned a lot of things. So we have A&E unit with 18 beds and 5 HDU beds. Radiology unit with CT scanner, high-end CT scanner, X-ray machine and ultrasound scanners, surgical ward, maternity ward, 5 operating theatres. In addition to that, we have some other casualty. Now they have shifted most of the facilities to the new unit, and they also need some kind of support. MLT. At the moment, we don't have any single MLT and 1 radiographer and 2 physiotherapists, since this is a physical rehabilitation unit. Services to Mulathivu, Mankulam, and some other hospitals like Mana, sometimes Vaunia too, and 1 histopathologist and a laparoscope. This is also not included in the. Other than that, Mulankavil, Pudukkuduruppu, Chettikulam, Murukkan, no consultants. On top of that, Pudukkuduruppu and Murukkan, we have only 3 medical officers, including the MS. And nursing officer card is also very low, so we need to consider providing human resources to.
Of you, members of Parliament who are with us today, Secretary of the Ministry and Director General of Health Services, Provincial Director of Health. Of you, members of Parliament who are with us today, Secretary of the Ministry and Director General of Health Services, Provincial Director.
Able to attend the program, but he already blessed this meeting should be very effective and will really bring constructive and solution to the many of our problems. Here represented.
primary healthcare institutions which render integrated service delivery. The care for NCDs, care for elderly, care for cancers, palliative care.
So, thank you very much for once again. I thank all the people who were behind this to make this event a successful one.